Hi, I'm Dr. David Sulo, one of the pediatricians here at Panorama Pediatrics, and I would like to give you a little introduction to what to expect when you first have your baby at the hospital. While in the hospital, your baby will be taken care of by the team of pediatricians at that hospital. They are all highly trained in taking care of newborns, and they do a wonderful job. When your baby is first born, they will be given a dose of vitamin K to prevent a bleeding disorder, a dose of antibiotic eye ointment to prevent infection, and they will be offered their first dose of hepatitis B vaccine. We suggest that you go ahead and let them give the baby the first dose of this very important vaccine. In the first hours of life are what we call the transition to life outside the womb. During this time, if the baby does anything unusual, if they have trouble breathing, if they drop their body temperature, they may be evaluated for signs of infection. This will usually include some blood cultures, some blood tests, some antibiotics, and possibly a stay in a special care nursery. This is relatively common and not a cause for alarm. For most babies, no infection is found, and they're able to go home with their parents after about 48 hours of observation. In the first couple of days of life, most babies get jaundiced and lose some weight. Both of these things are normal, but too much of either one can be problematic, and it is something that we monitor while they're in the hospital. The hospital will usually do what is called a bilirubin level. That tells us the amount of jaundice that the baby has. If necessary, we may repeat this when we see you for the first time here at the office. We here at Panorama suggest that all parents breastfeed their babies. We do believe that this is the healthiest thing for a baby. While in the hospital, you may find, and I often tell a lot of my first-time parents, that breastfeeding is natural, but it doesn't necessarily mean that it comes naturally. You will often have some fits and some starts at first. It could be a little difficult, and it could be frustrating. Each hospital has a team of lactation consultants who are wonderfully trained and experienced in helping first-time mothers to nurse their babies. We very much recommend that you take advantage of their expertise while you are there in the hospital. When you come home and we see you the first couple of visits here, we will continue to support you in this endeavor.
We are very supportive of our breastfeeding moms.
I'm one of the lactation counselors, so if you have any questions with breastfeeding, I'd be happy to work with you.
Feed your babies every 2 to 3 hours.